The Medical Minute, bringing you up-to-the-date medical knowledge for healthier living.
Good morning. It is 7:25 on your Monday. Time for our Medical Minute. Today I'm joined by Dr. Michael Blake, a pediatrician at Bozeman Deaconess Medical Associates. Thanks for joining us, Dr.
Thanks
Blake.
for having me.
It's almost summertime. Let's talk about how to protect your kids from the sunshine out there.
All right, a lot of things to think about. Most important thing is the time of day to be out in the sun. Again, we recommend, generally speaking, that you avoid being out in the sun for any length of time between the hours of 10 and 4. This is when the ultraviolet light from the sun is the most intense and can cause the most severe burns. It's important to remember, even on cloudy days, there's a significant amount of this ultraviolet light that gets through the clouds too. So even cloudy days, you need to think about sun protection. For kids less than 6 months, the recommendation is really to avoid any direct sun exposure at all. Between 2 months and 6 months, you can apply small amounts on exposed surfaces of baby skin, but again, the general recommendation is to avoid it if all possible. For everyone else, toddlers and teenagers, we recommend applying sunscreen 30 minutes before going out in the sun. Gives it time to soak into the skin, and then it should be reapplied every 2 hours if you're out in the sun. And that should be more frequently if you're in swimming or if you're playing basketball or doing some other strenuous activity where you're sweating quite a bit.
Okay. Also a good idea to make sure your kids are maybe wearing sleeves or hats or in the shade.
Exactly. There's some additional protective things that you can do. Wearing a wide brim hat with at least a 3-inch brim is very helpful. Light, tightly woven clothing reflects the sun. It doesn't let the sunlight through. This is also very helpful.
Okay. Dr. Michael Blake, thanks for joining us. That does it for today's Medical Minute.